You are watching the Doctalk show.
The coronavirus is a viral infection. Unlike so many other viruses, most times the body finds a way to get rid of the virus out of the body. But in some instances, it requires the role of a vaccine. So I want to know, is there a vaccine for coronavirus? And is it effective? Well, who to start with? Maybe Dr. Christine?
So there currently is no vaccine for COVID-19. There are several trials that are ongoing to test and see if there is a vaccine that is effective. But these vaccines are still in their very early phases. So we still need to wait and find out if we'll be able to get a good vaccine.
However, but how do, maybe before we move too far, how exactly do vaccines work? So that people will properly understand what it is.
Vaccines work in several ways. So sometimes they they immunize or they vaccinate you with a part of the organism you're trying to prevent infection with. And this helps stimulate your body to produce what we call antibodies, which we can say in Uganda, it's almost a translation of soldiers, to produce soldiers against this organism, so that subsequent exposure to that organism, the organisms will meet those antibodies or those soldiers in the body as well. So there are very many mechanisms, but usually it's a way of priming your body to produce a defense mechanism against that organism. So these mechanisms in the body are already existing. So that's why we already see people getting better from infections without having treatment, because your body already produces soldiers naturally. It has white blood cells, it has antibodies that fight against infection to prevent you from getting worse or getting sick.
Or maybe, is it that the vaccines we got from childhood, like the ones against polio, against all those, the 6 killer diseases, did those play a role in preventing Africans from getting the corona?
Well, I know where this is going. You're talking about the TB vaccine.
The TB vaccine,
yes.
The BCGs and...
Yes, so there was a publication that came out where they were, should I say claiming, or suggesting that the BCG, which is the tuberculosis vaccine, was the reason why Africa was not getting coronavirus. That was the very early stages of this pandemic for Africa. We didn't have, I think at that point, we didn't have any cases in Africa. And the thought was that because BCG is given against tuberculosis, which is a pneumonia, a type of pneumonia, it is protective against corona. But we know that that is false. And we think that there are many other factors that could confound that finding, that might affect that finding. For example, BCG is usually given, yes, it's given at birth. It's given in a certain population where they're high risk of TB, but there are very many other factors around that that might actually be the ones that are preventing or augmenting a spread of a certain disease.
So it isn't the TB vaccine?
It is not the TB vaccine.
It is just some other things around.
There might be some other, what we call confounders.
Yeah. Okay, that's where that is in research language. Now, talking more about treatment, Professor Pauline, people are concerned about the need for ventilators versus the need for oxygen. And some are wondering, are they the same? Like when we talk of ventilators being very few in the country, do they mean oxygen is so little? Like, what is the difference between those two when it comes to treating corona?
Okay, so as we said, coronavirus infection or COVID-19 disease currently does not have a cure. So the standard form of treatment for patients with COVID-19 disease is supportive therapy. And by supportive, I mean we give the patient substances that can help their bodies overcome the disease and can help them survive better. We know that patients infected with coronavirus come down with what we call hypoxia, poor oxygen carrying capacity of their red blood cells. So they actually lack oxygen.
Little oxygen in the body.
Yes, little oxygen circulating in their bodies. The cells cannot carry that oxygen. So the form of treatment, once we know that this patient is failing, the patient's red blood cells are failing to carry oxygen, we supplement them with oxygen. And that brings me to your question, Dr. Owachi. Oxygen can be given. We all breathe in oxygen in the air freely without any tubes. We should thank God for that. But once you are sick, you need, and your oxygen concentration is going down, so you need to be treated with more oxygen at a higher concentration. So in the hospital, we can give oxygen through a tube that goes into the nose, or we can use a mask that is around your nose to deliver that oxygen. But once your body and your respiratory system, your lungs and your muscles cannot function on their own to expand and contract.
No, that's to do the breathing.
Yes, when the breathing effort is poor, then you require external help. And that's when the ventilator comes in. The ventilator is to help your body to breathe in and out, your respiratory system, your lungs to breathe in and out. And through that process, oxygen is delivered. So there's a difference. Oxygen is not ventilator, and ventilator is not oxygen. Oxygen is air.
Oxygen is the air.
Yes.
That we can deliver. It's like a drug.
Yes.
But the ventilator is a machine
Yes.
that does the breathing for people.
That does the breathing for you.
Okay, so the people who are in the Mulago hospital, did they need ventilators? How was that situation?
So I haven't actually treated the patients myself, but the patients so far in Uganda have not, none of them has required ventilator support. Okay. And none of them has required treatment in the intensive care unit. That means that we have not had a critically ill patient with COVID-19 disease so far in Uganda.
So at least that has been cleared. That is very clear. Oxygen, yes, is given to people who cannot, whose bodies cannot circulate the oxygen within itself. Maybe be a problem of the breathing. They cannot breathe properly, so the oxygen cannot enter the body. And that is called hypoxia. So that's why they give oxygen, whether via a tube or via a mask. However, if the person cannot breathe eventually, for example, I don't know, is unconscious, or the lungs are full of water, in those cases, they'll need a ventilator to push the air into the body. So I think that's pretty much well understood now. So as we conclude, are there any final remarks you'd want to give? Any, I don't know, final points, remarks, preventive messages?
I think for COVID-19, the take-home message is prevention is better than cure, because we have no cure. So prevention is key at this point. We have a series of measures that people have heard over and over: social distancing, wearing a mask, hand washing, and I think those are key to take us forward, to keep the numbers down as they are now, and we pray that they remain as they, the numbers remain low. So I think with a very cooperative population, we'll fight this war and succeed.
Thank you. Professor Pauline, any final words?
Yes, my final words are basically to emphasize prevention, the hand washing, use of sanitizer. For us health workers, it's very important that we wear the masks. Social distancing is very key. So we need to prevent ourselves from getting infected with coronavirus. And our behavior needs to change. I know that currently hand washing in this country is still at a low level. We need to change that. And our behavior and life is not going to be the same, because the coronavirus is here to stay. It's not going to go away tomorrow. So even as we push the government to lift the lockdown, we need to know that we need to keep on with these preventive measures in our daily lives, in office, in the homes, in the hospitals, in the market, basically. Everywhere. The behavior just needs to change because the virus is here with us.
And the behavior we're talking about is hand washing with soap and water. Cover your nose whenever you cough or sneeze. That is called coughing etiquette. And I don't know if social distancing will continue. And do not touch the soft parts, please, please, please.
The soft parts of your face.
His Excellency was very clear on that, and you all know why. The hands can be very dirty, so sometimes you can put things there, and who knows what you'll get. So we want to appreciate and thank our dear physicians in studio, Professor Pauline Biachika, the head of the Department of Medicine, Makerere University College of Health Sciences, and Dr. Sekaja Christine Wilshire, a physician with Mulago Hospital, and the Vice President of the Association of Physicians of Uganda. This show was brought to you by the Association of Physicians of Uganda in collaboration with the Department of Medicine at Makerere University, the Scottish Funding Council through the Infectious Disease Institute. So I want to thank you very much, doctors, for coming on the show to take us through this discussion around coronavirus. So if you have any questions or any ideas that you're not quite sure regarding the coronavirus, you know what to do. Just send it onto our social media platforms. We'll be so happy to respond to them. For now, goodbye.